Hey guys, today I thought I'd start off on a little bit of a serious note or talk about something that's been bothering me quite a bit. Did you know that I did not cry once? Not when I was diagnosed, not through all the cancer treatments, nothing. And it's probably because I've worked in child hospice, I've worked with stem cell transplants, and now I work on the NICU. So you're accustomed to seeing death, and I've been accustomed to seeing cancer. So the thought of, oh, why me never hit me because I have seen some great, great people that have survived and others that have died and they didn't deserve it. So I don't think cancer picks and chooses, it just happens. But there have been two things that have really bothering me, and it's been my cancer groups. I don't think I can do them anymore. It's really hard to be on both sides. And when I say both sides, I mean working as a healthcare provider and then also being the patient, because sometimes you just want to shake people and tell them what to do, but you can't do that. But you're supposed to say what you think in these groups. So it's really hard to find the balance of, like, if somebody, let's give you an example, if somebody knows they have a certain amount of time to live, nothing's going to help, but they're saying, oh, chemo can prolong, maybe. And I'm thinking, just go and freaking enjoy the rest of the time you have left and don't do it being sick. But that's only because I've seen that sick. I've seen that kind of sick. I've been through that kind of sick. So it frustrates me to no end. And then it's, I see so many issues that arise with the healthcare community not diagnosing things in time. And I had this struggle as well. I called, I pushed, I called. And I know a lot of it has to do with being understaffed and people are overworked. And a lot of people left after COVID. A lot of people are getting fed up with being overworked and underpaid. You know, we picked this profession and then we're bound by law to come in. It just doesn't seem right. It feels like we're underappreciated. And that's the problem. Not by the patients, not by their families, but maybe the employers. I'm not going to say which employers, but I think when I came back, and every year here we get like a bump and a raise. Sorry, I couldn't think of the English word. And I found out that I was in one of the lowest tiers, even though I've been working for this hospital for several years. I go to every seminar I can. I go to web seminars. I did one today, unpaid, because I have a thirst for knowledge and I want to do and know what's best for our patients. And then I find out that I was based upon my work when I was pulling 250 overtime hours, when I had cancer and was still coming into work, even though I didn't know I had cancer, and I'm in the bottom tier. Like, it was just like a real slap to the face. I've been thinking a lot. Like, they say when you go through cancer, a lot of the times, you'll have these existential questions. And it really hit me like, why am I doing this? Why am I doing this anymore? We're not appreciated. Healthcare workers, policemen, firemen, teachers, we're all underpaid, understaffed. People are dropping like flies. Why are we even doing it anymore? And then I go to work and I get to, help a baby or their family, and then it just hits me like that happiness and that, I can't even describe the feeling. And that's why you do it. But it's like, is it worth it? it's a really hard balance because I do love my job. I love my job. I really, really do. But think it was a really cold slap to the face. And it's been a problem even before this race issue that, I thought honestly after COVID, people, the politicians, everyone would snap out of it and realize, how much we're actually needed. But that didn't happen. So that's why a lot of people are actually deciding to quit and change profession. And I don't blame them. And it really sucks. I'm really at a loss right now. I think this really hit me hard of like, wow, even after I busted my ass, I was always coming in for extra shifts. I was always striving to learn. I went to seminars, everything. And I'm on the bottom tier. I mean, people that started after me got more. And they don't have any experience. And I've been working for this hospital for years. And it's just, and I've had 4 different bosses. How are they even, determining the kind of work I do when nobody even knows me? I mean, I'm on my 4th boss. I'm going to have a 5th one soon. So it's like, how are they even judging your work? And I don't know. I'm just really sad. It makes me really, really sad. Sadder than the cancer, actually. And that was just like a huge blow that I realized lately. I'm going to have to cut this video so that I can actually post it here on TikTok. So join me for part 2.